This research, completed during my Centre for Perioperative Care Fellowship, sought to understand the extent of pharmacy staff involvement in preoperative assessment services in the UK. The Royal College of Anaesthetists GPAS Chapter 2 recognises the benefits of pharmacy staff involvement in pre-op assessment, but recommendations are graded as aspirational. Anecdotally, there is large variation in the availability of and role of pharmacy staff in pre-op clinics. Part 1 of the survey sought to establish the presence or absence of pharmacy staff and any identified barriers. The short survey was shared by the CPOC Perioperative Leads Network, GIRF Non-Medical Leads Network, UK Clinical Pharmacy Association and Scottish and Welsh Periop Medicine Societies. A longer Part 2 survey to understand the workforce, the service model and the role of pharmacy was sent to those sites with a pharmacist in post. 149 Part 1 survey responses were received. After excluding duplicates, there were 111 responses covering all 4 nations, the NHS and private sector. Unsurprisingly, most respondents were from England and also from district general hospitals, which account for the largest number of acute sites in the UK. 35% of responses had pharmacist involvement, 27% had informal input with queries, 1 site was setting up a service, and the remainder had no pharmacist involvement. 21% of respondents from district general hospitals had pharmacy involvement, compared to approximately 50% of all other respondents. However, in reality, we anticipate these percentages to be lower due to unexpected positive response bias. Over half of the sites with no or informal input had considered pharmacy involvement, but in nearly 60% of cases, funding had been the greatest barrier. 26 responses were received for the Part 2 survey, giving a 67% response rate. Pharmacy involvement in services was largely either very well established or relatively recent, suggesting there is renewed interest in pharmacy staff involvement. 54% of services have pharmacists, 4% have pharmacy technicians, and the remaining 42% have both. There is a mix of service models, with pharmacy involvement typically at or after preoperative assessment, and the majority of services reserve this resource for specific higher risk patients. The role is diverse but commonly includes medication history taking, perioperative medication advice, warfarin bridging and VTE prophylaxis. Some services are also extending the role to optimization of comorbidities. CPOC, along with the Preoperative Association and GIRF, are collaborating on a pharmacy toolkit to support services with writing business cases and sharing learning from more established sites.